And just as a reminder, you will all collectively have 10 minutes.
Can you hear me? I'm Michelle Gutierrez. I'm a president of the mighty California Nurses Association, and I've been a registered nurse for over 26 years, representing over 100,000 RNs across the state. CNA is a proud sponsor of AB 2200. As a nurse in an adult family medicine outpatient clinic in Fremont, I witness preventable health care tragedies every single day that result from our profit-driven system of insurance. Patients forgo the medication and care they need simply because they cannot afford it. Meanwhile, health plan middlemen deny care to boost corporate bottom lines. I cannot tell you how many times a day I work 5 days a week in the last 23 years at Kaiser as a charge nurse of the clinic. I cannot tell you how many times a day I have to beg my patients who work 2 to 3 jobs just to pay for healthcare insurance they have no intentions of using unless they are dying. I would like for you to take a pause and remember that statement, because I don't want to waste today unless we move forward. They are counting on us. As the COVID pandemic ruthlessly demonstrated, high healthcare costs and poor health outcomes persist because access to an insurance plan is not the same as guaranteed healthcare for all. Our current profit-driven system is deeply inefficient, unaffordable, and unsustainable for California and our patients. It is designed to squeeze every dollar and cent from our health. As a nurse, I have a professional duty to ensure that my patients receive the therapeutic care they need. This is why union nurses advocate for universal guaranteed health care for all under a single payer system. The legislature must act with urgency to pass CalCare, because any delay will be paid through the health and lives of our patients. We must act now. CalCare would establish a single standard of care for all Californians, regardless of income, regardless of employment or immigration status, and regardless of whether an insurance company thinks we are profitable. Everyone gets the same high quality care. Everybody in, nobody out. Study after study has shown that a single payer system like CalCare is the only solution that would allow everyone to get the care they need while reducing healthcare spending overall. With CalCare, California would save lives and save tens of billions each year. This savings would go towards providing comprehensive care to all. In other words, CalCare would control costs without resorting to care rationing. Importantly, CalCare would not only save money, but it would improve their lives and practice of nurses like me and doctors like you. We'd spend less time and resources navigating insurance and have more time for our patients, resulting in better care. For our union members, CalCare takes healthcare off the bargaining table permanently. This gives us more bargaining strength to win better working conditions, safe staffing, and other protections on the shop floor. This is why CalCare has the endorsement of dozens of California unions, which represent over 2.3 million union members across the state. As union nurses, we understand that CalCare is an act of solidarity by placing every person in California into one system. In solidarity with one another, we would come closer to achieving health equity. It is my duty as a nurse to advocate for my patients and end suffering under our tiered system of care. Healthcare must be treated as a human right, not a commodity. We urge you to vote in support of CalCare today so we can begin to heal our broken healthcare system. Thank you so much for your time.